Hello, you're welcome. My name is Dr. Chris Williams, and I'm your host on Well Again. Well Again is your online health magazine program in which we look at fail-proof principles and protocols for regaining health and retaining health. You're welcome. It's so nice to be with us today again. All right, today we are looking at the prostate, okay? We are looking at the prostate. We are looking at prostate enlargement, okay? We'll probably take some other episodes to talk about some other things about the prostate, but we're looking at the enlargement of the prostate today. And there can be two types or three things that cause enlargement of the prostate. Number one, if there is an infection in what is called a prostatitis or prostatitis, okay, so there's an infection, maybe a bacterial infection. Prostate gets acutely enlarged, and then it can give symptoms. Also, it can be due to a cancer when the prostate cells go cancerous, and then it can lead to an enlargement of the prostate. But the one I want us to talk about today is benign prostate enlargement. That is enlargement of the prostate due to it's a swelling, it's an enlargement, but it is non-cancerous. It is non-cancerous. By the way, what's the prostate? The prostate is a male sex gland that is located behind the urinary bladder, and then it encircles the urethra. Urethra is the hole through which the male penis passes urine. Okay, so that hole, that lumen, a gland encircles it, and that is the prostate. Okay, that's why when the prostate begins to enlarge, it begins to give all sorts of symptoms and signs that are associated with urination. Okay, women don't have prostates. Okay, so it's only a male disease because it's only men who have prostate. So we said there are three types of prostates. Prostate enlargement. There's prostatitis, there is benign prostate enlargement or hypertrophy, and there's the cancerous prostate enlargement or prostate cancer. What happens is that after about 40 years, the prostate begins to enlarge in men. Okay, and that's because by this time also the testis begins to form less and less testosterone. There's an hormone called testosterone. It is the male sexual hormone. It is the hormone that makes men love sex so much. It is the hormone responsible for libido. It is the hormone for arousal. It is the hormone responsible for potency. Okay, so it's also in women, produced from the ovaries, but it is much less in women. It's actually about 8 times more in men than in women. So at about 40, the testis, which used to produce the testosterone, begins to not produce enough any longer. So the man finds that his libido begins to drop, his sexual performance begins to drop, his sexual appetite begins to drop. So what the prostate does is that it begins to take the few testosterone that's circulating in the blood, it begins to convert it to dihydrotestosterone. Now, dihydrotestosterone is more potent than testosterone. Okay, so what the prostate does is the prostate figures, since there's few, it does some things to the few that's available, so it can be more potent. In doing that, the prostate cells begin to hypertrophy. They begin to there's hyperactivity, and there's hyperplasia. It's called hyperplasia of the prostate cells, and that causes an enlargement. All right, so that's for short what happens. All right, so at about 40-50, the prostate begins to take over, not take over, but begins to be more active in supporting the testosterone system in the body. Because testosterone is reducing, prolactin begins to increase, estradiol begins to increase. These are female hormones, and the body doesn't like it. The male body doesn't like it. So prostate begins to turn the few testosterone that's available into very potent forms, and in so doing, it begins to literally, if you do a lot of exercises, you'll have muscles. It begins to have muscles. In quotes, it begins to hypertrophy. Okay, so that's exactly what happens. So the problems that will cause are several, but they are problems of occlusion, or problems of compression, occlusion and compression. Okay, so because it used to be a small pear-shaped gland behind the urinary bladder. Now it begins to enlarge, so it begins to compress on the urinary bladder. So the size of the urinary bladder, the volume the urinary bladder is able to retain reduces inside. Okay, that's one. Number two, it begins to also occlude the urethra, the passageway of urine, and so the person begins to have problems urinating, several problems urinating. What are the problems? Signs now. Okay, inability to empty bladder completely. So the man finds that he goes to toilet to wee, and then he's not able to empty his bladder completely. Okay, because the bladder is being impinged or is being rested on by the enlarged prostate. Also, inability to urinate sometimes. So the person, sometimes there's total occlusion. The person wants to urinate and he cannot urinate. That usually happens when it has really grown big, and it can turn into an emergency. There's also poor streaming. The person cannot the pressure with which the urine is coming is low, so urine literally will just be falling down instead of being flung across a meter or something. Poor streaming. Okay, and there's also what some people call it dripping. Okay, so the person finishes urinating, and then it will continue. After the man urinates, just one shake of the penis, all the urine that were in the urethra will come out, and then the man will be all. But people who suffer prostate find out that even after they have shaken their penis, the thing stops. It continues to drip. Okay, so we call it dripping. It continues. So difficulty in stopping to urinate, and then urgency also. They will be feeling burning sensation when they are feeling like urinating, burning sensation. Also frequency is going to urinate several times. Okay, so people who suffer prostate enlargement can get to the point where they are urinating about 6, 7, 8. I've had a man say he urinates about 9 times in the middle of the night, and that is not good at all. Between going to bed and waking up, he has to wake up about 9 times, to go and urinate. And then there's hesitation. Hesitation is dramatic. The man gets to the toilet and is trying to push so that urine will come, but urine will not come till after like 5 minutes, and some people 10 minutes. They have to stay there for like 10 minutes before the first drop of urine begins to come. Now, all these problems they just disturb the person's life. Prostate enlargement, chronic prostate enlargement can also lead to complications. It can damage the kidney. How? The compression on the urinary bladder can cause a backflow of urine to the ureters and then to the kidneys. So if that continues, it can cause hydronephrosis, and then because the urine will also, because there's stagnation of flow of urine, there will be infection. It can also cause pyelonephritis. So there's frequent infection of urinary tract, and then as the case advances, it can lead to buildup of urea in what we call uremia. Okay, by the time there's significant uremia, that means the kidney is already beginning to fail. Now, how do you know if you have prostate? If you have some of these things, then you can suspect whether it's prostate or not, especially if you are over 40, if you are over 50, and all that. Okay, I forgot to say that at about 50, maybe about 40% of men have prostate issues. By the time they are 60, it increases to 60% of men. And by the time men are 70, maybe about 80%, 80 to 85% of them have prostate issues. So how do you tell whether you have, number one, if you're in the age group and all these signs and symptoms are beginning to present themselves, you think. Now, don't forget, when there are prostate things, there is either infection of the prostate, it's either benign prostate enlargement, or it's either cancerous enlargement of the prostate. So you will need to see a doctor. Okay, and then if you go to a doctor, they will do a digital examination for you. They will put their hands in your anus and they will feel around. Usually a doctor can tell if your prostate is enlarged by so doing. Okay, and then you can also do a PSA, prostate specific antigen. There are some proteins that are produced by the prostate. If they measure it in your blood, they can tell whether you have prostate or not. The normal is 0 to 4 nanogram per mil or something. 0 to 4. Okay, that's the normal. If you are 40 and your PSA is reading about 2, you need, so normal is 0 to 4. Within 0 to 4, you are okay. However, if you are 40 and your PSA is already reading 2, then you need to be concerned, because that means by the time you are about 50 or 60, it may have passed 4, so you will have issues. PSA is an indication of how enlarged or how big your prostate is. Okay, so if you are 50 and your PSA is 3, for instance, you need to be concerned. You need to be concerned, because that way, going at that rate, by the time you are 60, PSA would have passed 4 and you'll have issues. Okay, so between 4 and 10, we diagnose. We say the person has, most probably, it actually diagnosed alongside the clinical diagnosis. They can also do an ultrasound scan of that area. But if the PSA result of a man is between 4 and 10, we say the person probably has a benign prostatic enlargement. Above 10 at any age, we begin to suspect cancer. So what should you do? What should you do? The first and foremost thing, like I always will say, is try to prevent it from ever happening at all. So remove junk foods from your food. If you ever have removed if you have ever removed a prostate, or if you have been there, sometimes when some doctors do prostatectomy for patients, they put it in, they preserve it and they give it to the patient. If they have ever given you, or you have ever seen, or they did the one for your father, you see that mostly it is fatty tissues. So abuse of fatty foods enhances prostate growth or worsens prostate growth. So right now, when you are 35, when you are 32, when you are 33, when you are 38, you should be concerned. That's why you should stay away from fat foods or fatty foods. It's so very important. That's why you should limit your intake of animal proteins. We have said stay away from beef, from chicken, from turkey. Just do only fish, and the drier the better. It's so very important, because animal protein, you can't separate animal proteins from animal fats, and animal fats will just go and settle into your body and do all the damages that we have been talking about all this while. So remove animal proteins from your food, reduce it drastically, and then also anything sweet, because when you take sugars or glucose, sugar usually will get converted into glucose in your body, and when your body has used the glucose it will use, the others it stores up as fatty acid, and which is fat. Remove complex carbohydrates from your food. processed carbohydrates, refined carbohydrates, remove them from your food. Okay, very important. Remove MSG containing things, all these chemicals that they use to cook food, remove them from your food. So very important. Stay away from wheat, stay away from wheat and flour foods. Basically, stay away from them. It's so very important. Go for other grains like oats, like millet, like guinea corn, like maize, like rice, go for all those ones. Stay away from all these things, and then stay away from foods like alcohol, like coffee, like tobacco, like caffeine, and junk foods generally. You see where some people are eating, they eat all kinds of things, shawarma, they eat all those things are storing up in the body for a later date, for a later conversation, I'm telling you. So you need to stay away from that. So very important. Alcohol particularly reduces zinc in the body, and zinc, people who suffer prostate have been in studies done, they have seen that they are always low on zinc. Okay, very important. So what other things? So remove bad foods from your food, and then eat healthy. Eat healthy. What should you eat? Blend and drink vegetables like cucumber, cabbage, carrot, beetroot, celery, parsley particularly, they are very helpful. Okay, cranberry is very helpful in cleaning the respiratory tract. Cranberry juice, drink them regularly. Do things reduce your blood cholesterol. Do anything that you have been told and that you have been told before to reduce blood cholesterol. Reduce it drastically. Excuse me. Regular exercising is very important. Regular exercising is so very important. Recently, I did my PSA about 2 weeks ago, and I was amazed. I'm 52, and I was amazed. I'm 51 going to 52. All right, so I'm 51, and then I was really amazed. Why? My PSA was 0.3. You know, we said normally 0 to 4. Mine was 0.3. I didn't expect it to be that low. I hadn't done it for some time, and I said, wow, these things work. And then a couple of days later, another person comes who is one of the practitioners of the things we said. Okay, he did his PSA. That the man must be around 59 years old, and his PSA was 0.7. I said, wow, this thing really does work. If you take your diet seriously and your exercises seriously, you will be investing in your old age. I'm telling you. Don't wait till you begin to have prostate symptoms before you begin to do stuff about it, because you may not be fortunate. You may be unfortunate for the variety of enlargement you have to be the cancerous variety. Okay, so very important. Regular exercising, so very important. Avoid exposure to very cold weathers, so important. Avoid exposure to very cold weather. That's very important. So there are supplements like acidophilus. Acidophilus helps to break down metabolites of estrogen. So even if it's 2 or 3 times a week, take acidophilus. It does help you. Quercetin has anti-tumor activities. It's a flavonoid and it has anti-tumor activities. Tumors are either benign or cancerous. Quercetin is very good for that. Selenium and ascorbate acid are very powerful antioxidant activities, and if you're on them, but be careful of selenium if you have heart issues. So very important. B complex along with vitamin B6, they also have anti-tumor properties. Zinc is very essential in either dealing with prostate enlargement or preventing prostate enlargement. About 100 milligrams of zinc on a daily basis is so very important. Also taking omega-3 and then L-glutamic acid, L-glycine, getting enough glutathione into your body regularly helps you. Okay, there are raw prostate glandulars. Glandulars are sometimes they found out that if they take glands of animals and they process them and make them into supplements, they can also help us. So there are some preparations that are made out of prostate gland of animals. If you take it, it will help your own prostate to to be in health, to heal. It will help your prostate to heal. Vitamin A and vitamin E, lecithin granules. Lecithin is a good fat emulsifier. Anybody that wants to take fats away from their body, you should be on lecithin. And then calcium, magnesium are also very helpful. There are some herbs that are helpful also. Herbs like parsley, like slippery elm, like yuva or sea, cranberry, yuva or sea, chanca piedra, dandelion. These are very, very powerful urinary tract herbs, and they are so very useful. Bilberry is also very useful. And then if you are dealing with prostate, you need to be on echinacea, because echinacea and golden seed, but be careful of golden seed. These are very good anti-germicidals. Okay, some other herbs are saw palmetto, turmeric, stinging nettle, hydrangea root, and marshmallow. All these things are available. If you need them, you just need to call us. But before you call us, make sure that you talk to your doctor and know and ask their permission before you can use this, because like we usually will say, these things we are doing it not for prescription purposes, for information purposes, so you can know that there are some things to do naturally to deal with prostate issues. You need to first talk to your doctor, and then you can talk to us. We can help you get these things. We can help you secure them. All right. Do not forget to share. Do not forget to turn on your notification links and then your notification button. Sorry, and then do not forget to subscribe. Okay. Also go to our channel, Dr. Chris Williams, Dr. Chris Williams is our YouTube channel, and there are several other things that we have talked about there. All right, you do not need to fold your hands and watch prostate issues creep up on you. Some people, I mean, it just literally makes their old age very miserable and very painful. Okay, they some people have to carry catheter all their lives. Some people have to get to the hospital every 2 or 3 days to change catheters and all manners of things. You enter where some old men live, their sleeping spaces, and you are smelling urine everywhere because prostate is causing dripping and all that kind of thing. The time to start is now that you are 40. The time to start is now that you are 50. Start doing something about your prostate. The first thing to do is to go check up your prostate level. Don't forget to subscribe. Don't forget to share. Don't forget to turn on your notification. And do not forget, we have not prescribed. We are only giving information. All right. Before I talk about our books, I just wanted to also remind you that there is life after now. This world we are living in here is a rehearsal for the real thing. The real thing is life after now. And this is time just given to us to prepare for the life after now. Make sure that you do not exit into eternity without Christ. It's so very important. Make sure that you have an encounter with Christ. Make sure you walk with him, and he said, the peace that I have give I unto you, not as the world giveth. Okay, the peace that one has walking with God is enormous, is immeasurable, it cannot be quantified, it cannot be explained, it's inexplicable. Okay, Jesus loves you. You want to come into your life. He died for you so that you will not perish. All right. Many people on a daily basis are closing their eyes and they are going into eternities without Christ. And eternity without Christ is full of pain, is full of mystery, and is full of burning. You can receive Jesus into your life. You can just ask him to come into your life, come and be your Lord and personal Savior. All right. Thank you. And if you do that, let me know. Or also, if you want to reach us in any way, these WhatsApp links are very helpful, are useful. You can reach us on them. So our books are here: Reversing Diabetes Naturally, It's there. It's a very powerful book. These books are very powerful. They have helped so many people. And then reversing depression naturally is also here. And then there's also reversing hypertension and cardiovascular diseases naturally. And then this one says, make your food your medicine. Make your food your medicine. And our powerful product here, sickness-free, fail-proof protocol for regaining and retaining health. Thank you so much for having listened today. Please help us share, help us turn on your notification, and then also subscribe to our channel. Let's see how far we can go in ridding the world of sickness and disease. Thank you so much. God bless you. Bye-bye.